Hello imposters, welcome to our third case in this collection of high-yield USMLE cases. Let's get started. Our case today is a 58-year-old woman who recently immigrated to the United States from Central America. She presents to the clinic with difficulty swallowing, constipation, and abdominal pain. She says her last bowel movements were more than a week ago. Physical examination reveals tachycardia and cardiac exam reveals a murmur. An ECG shows Mobitz type 1 heart block. So I want you to kind of think about these things, and this is the time to pause before I show you the answers. The diagnosis for this patient is Chagas disease, or trypanosomiasis, caused by Trypanosoma cruzi, which is a protozoa. This is transmitted by the Reduviid kissing bug. I wanted to derail here really quick so that we're not confusing this with the other Trypanosoma species. So there's other ones like Trypanosoma gambians and rhodescens. So these are the ones that are carried by the tsetse fly, and these are the ones that are causing African sleeping sickness. That's a fly bite that hurts. If you don't already use a visual mnemonic for memorization, I remember this as gambling on the road. So like Trypanosoma gambians and rhodescens always hurts. Gambling on the road always hurts. And how I differentiate that with the kissing and the cruzi is cruzi here has a k sound. That's the same as kissing, and Reduviid has two eyes and kissing has two eyes as well. So moving on to presentation, based on this woman's symptoms, do you think she has the acute or chronic version of Chagas disease? Well, you'd be right if you said chronic. For the acute infection of Chagas disease, we would see Romagnacine, which is essentially a painless swelling of one eye. Another thing that we would see are chagomas, which is essentially an inflammatory response at the bite site, fever, meningoencephalitis, which would present with a variety of things like vomiting, sensitivity to light. So notice how these kind of things make sense that they're acute signs. For chronic signs, we would see heart block, ventricular tachycardia, dilated cardiomyopathy, megaesophagus, and megacolon. So these kind of all fall into the category of things that are hard to treat or just very complicated things. So those are how you can differentiate between acute and chronic. The treatment for acute Chagas disease is nifurtimox and benznidazole. There unfortunately are not any treatments for chronic Chagas besides the supportive treatments, so like pacemakers, antiarrhythmic drugs, surgery possibly to fix megacolon, laxatives, and things like that. So how do we prevent getting bit by the kissing bug? So it's simple as wearing long sleeve clothing, using bed nets, and insecticides. Here is our visual slide. Here is that characteristic crescent shape of I don't want you to get confused with the mastigotes and macrophages. Those are the ones that are found in sandflies that carry Leishmania protozoa. So this is a peripheral blood smear. As you can see, these are red blood cells. Here is a photo of the Reduviid kissing bug. I kind of tend to remember this bug because of the chronic complications like dilated cardiomyopathy and dilated megacolon, and this over here just looks like a big, back end with the wings and the body. If you have never slept with a bed net before, this is what it looks like. It's literally just a net over the bed to avoid bugs from coming in. This is used very commonly in other countries to avoid getting bites from mosquitoes. So here we have Romagnacine. So here you can see this unilateral puffiness of this eye and this child. And over here is a more severe case where you can kind of see that puffiness of this eye. The trachoma that I was mentioning is the inflammatory response at the bite site right here. So remember that this bug, the kissing bug, kisses essentially your skin and it shouldn't hurt. This is painless. The painful one is the tsetse fly. And so everything over here are the chronic complications of Chagas disease. So here we can kind of see a dilated heart. Here is a toxic megacolon. You can see that the hofstras over here, you can't see them anymore because they're so dilated. So these are the hofstras. And here is a abdominal x-ray of toxic megacolon. We can also see this in what other disease? Ulcerative colitis. So here is the lead pipe sign. We don't see the hofstras anymore as we can see in the other parts of the colon. I know heart blocks can be very hard to memorize, so I want to share with you a mnemonic that I found created by Hippocrat TV over here, so go ahead and give them some love. I think it's one of the best mnemonics out there I found for heart block. The mnemonic is related to Taylor Swift, and it's related to how the media is so focused on her relationships. So her song Blank Space, the one where it goes, gotta love those Starbucks lovers. I'm just kidding, star-crossed lovers. The mnemonic here, blank space, is essentially the PR interval interval here is prolonged. It's more than 200 milliseconds. So here is our P wave, here is our QRS. So the PR interval is right here. So notice how it's just a blank space before the QRS. So that's the mnemonic for first degree AV block. The second degree AV block, there's 3 different types that we'll go over. So the first one is Mobitz 1, or it's also called Winky Bach. And the mnemonic here is Winky Bach. Kind of sounds like the word wink. You kind of wink at your crush for a little bit, you wink a little bit longer, and then you find out you don't like them anymore, so you drop them. So it's long, longer, drop. So remember, the theme here is relationships, not necessarily the most healthiest relationships, but relationships. So long, longer, drop. The Mobitz type 2 is constant drop. So instead of the PR intervals getting progressively longer, like in Mobitz type 1, it's a constant, but they're all prolonged. They're all over 200 milliseconds, but they're just a constant PR prolongation, and then it's a drop. So it's long, longer drop, and then constant drop. And then we go to third degree block, which is essentially everything is not in sync. So here is a P wave, here is a QRS, here's another P wave, here's another QRS, here's a P wave here, here's a P wave here, here's a QRS. So the P waves are regular, the QRSs are regular, but the P's and the Q's are not really in sync with each other. So that's how you remember third degree, where everything is just sporadic. This is another type of relationship where you're just totally not in sync. So the third type of second degree AV block is 2 to 1. And this one's super easy to remember because it's literally just in the name. It's 2 P's to 1 QRS. So what I mean by that are 2 P's to 1 QRS. So 1, 2, and then 1. So 2 to 1 QRS. So that's the third type of second degree AV block. I know EKGs can be very daunting for some people, but I think this mnemonic has helped me so much on studying for my tests that I didn't really need to. Whenever I got a heart block question, I just came and used this mnemonic and I was pretty much good to go. If you want to check out the original mnemonic video, I'll link it in the description box as well for you. Here is our summary slide, and today's topic was Chagas disease, heart block, microbiology, and some EKGs. Here are the first 8 pages listed here for you, and as usual, our high-yield munchies for this case was Chagas disease is an infectious disease caused by the protozoa Trypanosoma cruzi, which is carried by the reduviid or kissing bug. Chagas is endemic to Central and South America. Acute infection signs to look out for include fever and meningoencephalitis. Chronic infection signs include development of dilated cardiomyopathy, megacolon, megaesophagus, and heart block. Look out for trypomastogotes on peripheral blood smears. Treatment for the acute infection is benznidazole and nifurtimox. That's a wrap for this case. I have linked the YouTube channel that I mentioned about the heart block mnemonics in the description box if you want to take a look at that. Let me know in the comment section if you have any questions. Thank you so much as usual for supporting and liking the video and subscribing. I'll see you in the next case. This is Imposter Med signing off, and as always, be happy and be kind.